Professor, we don't often hear the word breakthrough from a scientist. In your opinion, are we at a new threshold in the treatment of cancer?
Yes, we are. Immune therapies have always been a holy grail for people treating cancer, and everybody's been always aware that cancer is a disease that avoids the immune system. And scientists have been desperate to understand how that happens. And now, at long last, the first key mechanisms are being understood. And so scientists can now develop treatments that stop cancer cells evading the immune system.
So what are these drugs actually doing? Are they kick-starting the body's immune system so that the body recognises the enemy within, so to speak?
So that's a really good example or description really of what's happening. So the cancer cells are sort of very cleverly blocking the immune system. The immune system in a patient is waiting to destroy the cancer cell. So these new drugs now unblock that and allow the body's immune system, the patient's immune system, to attack and destroy the cancer cell. So it's exactly what's happening.
What are we seeing in clinical trials? Are we seeing the tumours shrink faster and take longer to grow back?
In some cancers, we've understood the immune system is key. Kidney cancer is an example, skin cancer, particularly melanoma, is an example. And these drugs are allowing the actual immune system to absolutely shrink the tumours, make them disappear in some cases, and allow the remaining bits to be controlled so it doesn't re-emerge as rapidly as it can do after conventional standard treatments that cancer patients receive. So that's a huge shift in what patients hope for.
So what does all this mean for the individual patient?
Well, for example, I had a patient last week who's in her early 50s. She's a very busy family life and was devastated when she heard that her melanoma had recurred. And she was frightened, understandably, of consequences, the risk of the side effects of treatment, and how it would disrupt her life almost immediately the next day. But when you're able to discuss with a patient like that a wide variety of different options, including treatments which will have potentially less side effect than they imagine, also have high rate of chance of success and a longer term benefit and durable benefit for a significant number of patients, the individual, she became more confident, much less anxious, and was able to become much more optimistic. And most importantly, she was able to host her big family event the following week with much more confidence about the future.
Are we a step closer then to saying that we've got a cure for certain types of cancer?
I think it's better to talk about control, and we are a step closer to controlling long-term cancer with these types of treatment and other treatments. So patients will probably have combination of approaches, but immune therapies will be one of those core treatments used in combination with others.
Professor Whittaker, thank you very much.